If you're a healthcare provider, you know the feeling. You're juggling in-person visits, telehealth appointments, and all the paperwork that comes with it. So often, it feels like you're spending more time battling your software than actually caring for your patients. But what if there was a better way? What if your technology could actually get out of the way? Well, let's break down a system that's designed to do just that. So the platform we're looking at is GoTo Telemed. And this isn't just another EMR. It's been built from the ground up for the reality of modern hybrid healthcare. We're going to walk through exactly how it tackles some of the biggest workflow headaches providers face every single day. Right, and this is the million-dollar question, isn't it? We've all been there. You're trying to manage one patient visit, but you're toggling between 3 different windows. You've got one for the video, one for the chart, another for e-prescribing. It's not just clunky, it's a recipe for burnout. The goal shouldn't be to add more tools, it should be to bring them all together. And the solution really is to have one single unified command center. Think of it as your digital workspace, where absolutely everything you need, from seeing the patient's face, to documenting the visit, to sending that prescription, is right there at your fingertips, all in one seamless flow. Okay, let's get into the nitty-gritty. This is really the engine room of the whole platform. You've got secure, HIPAA-compliant telehealth built right in. No third-party apps needed. It's ONC certified, which is just a fancy way of saying it plays nicely with other health systems, so you're not trapped in a data silo. And with integrated e-prescribing for controlled substances, or EPCS, you have a critical tool for so many practices. It's the whole shebang, a completely connected ecosystem. Look, your day has to start with security. To protect that sensitive patient data, every simple login requires multi-factor authentication. It's that really simple, quick step, your password plus a quick code from your phone, that creates this powerful modern defense against anyone trying to get unauthorized access. And security isn't just about who can get in the front door, it's about what they can see once they're inside. Role-based access means your front desk staff sees the schedule, your biller sees the claims, and only clinical staff can see patient charts. This automatically enforces HIPAA's minimum necessary rule, basically protecting data from the inside out. It's just smart. Once you're logged in, this is your mission control. No more digging through menus to figure out what's next. The dashboard gives you that immediate, at-a-glance view of your entire day, your schedule, any critical alerts that need your attention right now, and all your pending tasks like signing off on charts. Everything you need to act on is right there. Now, let's pivot to the patient experience, because that's just as important. It all starts with a virtual waiting room. And this is so much more than a digital queue. While patients are waiting, they can actually complete their intake forms and update their info. For you, it means you see this neat line of patients who are checked in, prepped, and ready to go. It makes the start of every visit incredibly efficient. So before you even dive into the clinical conversation, there is a critical compliance step you have to take, making absolutely sure your patient is who they say they are. The system actually guides you through this mandatory identity check, making sure this fundamental requirement is met and, importantly, documented for every single telehealth visit. Okay, I know this might look like a long list, but each one of these items is a critical piece of the telehealth puzzle. This isn't just bureaucratic box ticking. These are the things that make a telehealth visit legally and medically sound. From confirming the patient's location for state licensing laws to documenting their consent, these elements protect both you and your patient. And here's the best part. Here's how it all comes together in your actual note. Using smart templates, all those required elements are built into a concise compliance statement. This creates a defensible medical record in a fraction of the time it would take you to type all of that out by hand every single time. Of course, patient care doesn't stop when the video call ends. The e-prescribing workflow is built for safety and for speed. As you're selecting a medication, the system is working in the background, automatically checking for potential interactions or allergies. And for controlled substances, it uses that same secure 2-factor authentication from your login, which keeps you fully DEA compliant. Ordering labs is just as streamlined. You can pull up common panels, attach the right diagnosis codes to justify medical necessity, and then send the order directly to the lab electronically. And the best part? When those results are ready, they flow right back into that same patient's chart, closing the loop so absolutely nothing falls through the cracks. And hey, the patient's journey doesn't end with the visit either. That's where the patient portal is a total game changer. It empowers patients with 24/7 access to their own records and lab results. Plus, it cuts way down on phone calls by letting them handle refills, scheduling, and payments on their own time. That frees up your staff for more hands-on work. It's a win-win. All these amazing features are built on a bedrock of security. And to really get why that's so crucial, we have to understand the risk. A HIPAA breach, in simple terms, is any unauthorized access to patient data. And the consequences? Well, they can be devastating for both the patient and the practice. So to prevent those breaches, you need a layered defense. The GoTo Telemed platform is built with all three required safeguards. You've got administrative controls, things like policies and training. You've got technical controls, like the data encryption and multi-factor authentication we've already seen. And you have physical controls that secure the actual servers where the data lives. You need all three. And one of the most powerful technical safeguards is the audit trail. Just imagine a patient is worried that someone looked at their records improperly. With a detailed log like this, you can see exactly who accessed the chart, when they did it, and what they looked at. It provides complete transparency and is your ultimate tool for accountability. So it all kind of brings us to a final thought. This integrated, secure, and streamlined way of practicing medicine, it isn't some far-off concept anymore. The future of healthcare is already here. I think the real question is your technology ready for it, or is it holding you back?